Now, a patient today, this is his second shaft and glans for a scrotal treatment, which is kind of neat. A lot of guys don't know about doing the scrotum. Scrotum's important for several things. Number one, it prevents the testicles from rising up. As you know, when the scrotum contracts, testicles go up very uncomfortable. Okay, hold on just a second. Yes. All right, so why don't you can move forward with injecting. Okay, all right, thank you. So we were talking about the scrotum. That was our next procedure, but doing the scrotum, we put filler in the skin of the scrotum. It forms collagen, causes an increase in girth of the scrotum. Helps prevent the contraction of the scrotum, because the scrotum itself has muscle cells in there, okay? It has muscle cells in a certain layer of the scrotum, and they contract. That's how come the testicles will go up if the scrotum contracts. Why it contracts, it could be nervousness, could be the cold weather, a whole host of things. But we don't like it, right? As men, we don't like that feeling and so forth. So if you put filler in the scrotum and you build a lot of collagen there, it's hard for those muscle cells to counteract or flex their muscles against that collagen. So in essence, the scrotum stays relaxed, right? So it keeps the testicles down. Number two, why we should consider doing it, or the patients, is that it increases volume, right? So as you build your shaft and gland size, the scrotum appears smaller and smaller. So that will help increase the size, and also in proportion, for proportion. Lastly, it's a package proportionality issue too, right? The package, the shaft, gland, scrotum being larger, a lot of guys like that as well, okay? So that's that situation. So our patient today, second shaft, glands, and scrotum. The issue we had with him, it was a minor thing, is that he was making very good collagen. Some patients make soft collagen, some have dense collagen. If you're making the dense collagen, what happens is when I put filler in on the second treatment, it doesn't expand so easily, right? Because it's like a dense collar effect. It's like a straitjacket effect. So I was able to get a good amount of filler in today, but when he comes in next month, he's going to do his third treatment because he wants to get about 7-inch circumference. I said to him he has to pump. He's going to use a penis pump to help stretch that skin out, and I'm going to give him a protocol to do that. So he'll do well. He wants to get to 7. I'm not quite sure I can get him there after his third, but we're certainly going to try. And that's the objective for our patient Joe, and so forth. I'll be meeting with Joe in a little while. We're going to discuss that plan and so forth. And that's the summary about Joe for today. Now we have another patient coming in, a second shaft glands as well. We'll talk about him later. And I also have another patient after that, which we'll discuss. Okay, Sean, how we doing, my friend?
Good, thank you.
Good to see you. How's the area?
New York, yeah.
You ready to rock and roll?
Ready.
All right, now I'm going to have you put your hands on your chest for me.
Yeah, sure.
Kind of comfortably like that.
Like that?
Okay, yeah. All right, let's see what we got going on here. You're coming from where again?
I'm from Jersey.
Jersey, where?
Jersey City.
So what is it, hour and a half?
Oh, no, it's like a half an hour.
Ah, what bridge did you take to come over?
No, I took the path.
Oh, you trained?
Yeah, the train,
I got you. Okay, all right.
Yeah, it's like a 9-minute walk, yeah. Up there.
All right. Now, what I'm going to do first is put some antiseptic on. Even this is a little chilly, of course, you know, it's a little cold. Even my Canadian patients get a little chill out of this, yeah. So I can only imagine my New Yorkers and tri-state Jersey guys, how that feels. Here's what I'm going to do, just in case. My gut feel is you might have to stretch a little bit with a pump. In other words, your skin is really good. When you get really good skin, your erections, if collagen forms well, you get a firm erection. But let's say you come back for another filler and that skin's really dense. It's hard for me to fill now. It's like trying to expand something that's stiff.
Right.
That's good. So it's good. It's a good problem to have because you'll have a nice firm erection till you're 110 years old. But it's not going to help us get filler in there. So what we do is, let's say 60 days, 30 to 60 days prior to your next treatment, you use a penis pump to help stretch that skin a little bit for us. So that'll let us put more filler in. It works beautifully. And that might happen. I have a feeling it's going to happen because the way your skin is, I can tell you have thick dermis already. That's a plus. And the way it's going in, the pressure is rising, which means it's telling me that it's filling. And if the pressure goes up a little faster than usual, which it is, I mean, you're still going to get a lot of filler, but I could just sense it. Because remember, I've done a lot of these, so I know that you're going to need to pump and stretch. Because the idea is when you come to me, I don't want limitations. I want to be able to fill you to the max. In fact, Bert, my consultant, he had the same issue. He would only grow like a ½ inch per treatment. His skin was getting tight. So we decided, this is years ago, we used a pump on him. He started out like 4 3/4 girth. I could barely get him to 6. As soon as you started pumping, he's already at 8. So it opens the doors. We have a patient, our second patient we just finished here, Sean. I'm going to talk about him in a moment. Right now I'm looking at patients that we've done, and they send us texts and photos for follow-up, usually around 30 days or so. They'll send twice a week their rewrap pictures and so forth. If they have any questions, we go through our HIPAA-compliant application. All right, so Sean is here. We just finished him. It was for his second shaft and glans procedure. He had gained almost an inch in girth his first treatment. A goal is to get almost the same if possible on his second. He's doing quite well.